I'm Dr. David Silbert. I am an ophthalmologist who specializes in oculoplastic surgery, and I want to tell you about my revolutionary new eyebrow lift. A lot of people come to see me because their eyelids are drooping, and it's very funny because a lot of times they're saying the eyelid's drooping, but what they do is they actually do this, and they say, see, when I lift this, it gets better. Well, actually what they're looking at is the eyebrow. So frequently there's a droopy eyelid, which requires a blepharoplasty. That would be removing skin and fat from the upper eyelids. But a lot of times that's not going to do enough, okay? And so what we need to do also is we need to lift the eyebrow up so it's not hanging over. There are a couple ways that you can lift the eyebrow. And the classic approach, which works very, very well, is making an incision in the eyelid, making a little wedge of skin, removing the skin, and suturing it. And although it works great, it looks terrible. When you're finished, it just doesn't look good. Sometimes you can get away with it with men, but with women who don't have creases in their forehead, it's a terrible procedure, even though it works great. What I've developed is I've developed a new procedure, which is called a transblepharoplasty, meaning through the blepharoplasty incision. So it's a transblepharoplasty brow ptosis repair with ethibond suture. And the suture is a big braided suture. It's polyester suture. And what I do after I do the blepharoplasty, after I remove skin and fat from the upper eyelid, I pull the brow up and I dissect down underneath the eyebrow into this area and into the forehead. So it's like doing a forehead lift, but doing it from underneath. And then what I use is I use a large needle and I run the needle up under the tissue that I've dissected into the hairline. And then I pull the suture down and pull another suture down, and then I tie it so it lifts the eyebrow up. And the beauty of this is it lifts the brow. It's like suspenders for the brow, but there's no extra incision above the blepharoplasty incision. We actually did a number of cases, and we actually presented our cases recently at the American Academy of Ophthalmology, where we were accepted as a paper. The results are great, and all of a sudden I feel I have a wonderful procedure to deal with both droopy eyelids and droopy eyebrows. A lot of times it is covered by insurance. Sometimes it's not, but it's a reasonable cost to do this procedure. It's a great new procedure, and we'd be happy to talk to you about it. For the most part, what we're doing when we're doing eyelid surgery is removing excess skin and fat. We're sometimes lifting the eyebrow, we're sometimes lifting the eyelid or tightening the muscle. That's called a ptosis repair. And once we've done that, it's usually pretty good for about 10 years.
Perfect.
There are a number of reasons why patients will have eyelid surgery. Many patients come in because they're having visual issues. So if it's going to be covered by medical insurance, there has to be a visual issue that's causing a problem. So typically it could be problems with driving where there's sort of this hooding over the eyelid. So it's like wearing a baseball cap over your eyes. And you don't often always notice that you're missing something in your peripheral vision. So, traffic lights are above, so sometimes when the eyelids are droopy, you miss traffic lights. You can't see in your side view. Those are the sort of things people have. The other things people often notice will be issues with reading, because a lot of times when you look down, the eyelids become more droopy. So those are the sort of things that people will notice. Now, from a cosmetic standpoint, patients come and have cosmetic eyelid surgery. They're just bothered by the appearance of the eyelids. They sometimes have fatigue just from trying to lift their eyebrows to get the skin away from their eyelashes. So these are the typical reasons why patients will come in and want to have eyelid surgery done.